Hi, good afternoon. This is your County Executive Ed Day. We're here to do our weekly COVID update, delayed by a couple of days. You might notice I look a little different. You may have heard I did have shoulder surgery, relatively significant, but they say I'm going to be fine. My goal is to be able to throw the first pitch again next year at Boulder Stadium. I have a streak to maintain that I don't bounce the ball going. I got a load of thank yous and best wishes to heal better. And I just want to thank all of you for your consideration, your thoughts. It really means a lot. Just want to tell you that. First of all, being home for a few days, it gave me an opportunity to just look at a lot of the comments that were coming in, whether the emails or by Facebook. And one of the things that keeps coming up is the whole issue of what can or can't be done when a municipality is not pulling its weight. I want to just cover this briefly because it's really relatively simple, but the more frustrated people get, and I understand this, the more annoying it gets. So let me just lay out the prescribed responsibilities of government entities, just again, very briefly. Obviously, we all know we have separate levels of government here. We have the county level of government, we have the 5 towns, 19 villages, okay? They are all distinct, separate governmental entities, and in fact, according to New York State law, they're created so they're responsive to their own area, their own town, their own village, their own county. And there are not many opportunities for any of these entities to really coexist when it comes to who's in charge of whom. A town is not in charge of a village. A county is not in charge of a town nor a village. We have issues that we deal with countywide, roadways and other issues, courts, things like that. But that's just it's a separation that's there. We also have to deal with law enforcement. Rockland County does not have a county-wide police department as defined. Nassau County does, Suffolk County does, Orange County does. And the difference between a sheriff's department and a county-wide department is that a sheriff's department is overseen by an independently elected sheriff, which is a New York State constitutionally created position. That person is in charge and command and control of their entire department and their operations. They do not answer to anyone except to the sheriff. He's a public officer. A county-wide department, which was up for the ballot, I think, back in the 80s, the late 80s, I believe, here in Rockland County, and was roundly defeated back then. That is a department that is set up with a commissioner or a public service director, public safety director, for example. And those departments that I just mentioned, they do have either a commissioner or a public safety director. That person is responsible to the county executive, and in fact, as a general rule, that person serves at the pleasure of the county executive. So there's a direct control over the county-wide department in that case. Here in Rockland, I do not have command and control over any police department, as I explained about the sheriff, for starters. The town departments ultimately answer to the town boards, the 5 town boards. Those villages that have police departments, i.e. Spring Valley, for example, Suffern, they answer to the village board, and that's the way that works. When people are frustrated about what's being done and not being done, okay, let's be very clear about this. I cannot remove a town supervisor or village mayor from office. As I said earlier, it doesn't work that way. The bottom line is that there are 2 people in this state who have significant control over certain issues. One is the governor of New York State. He has ultimate control over every level of government. His executive orders, for example, which we're going to get into in a minute, that he issues can suspend executive orders done locally by local county executives, which is under the same statute, Executive Law 24, Section 24. The other person who has a lot of power and usually is not mentioned too often, the New York State Controller. He is ultimately responsible for each and every local budget. In point of fact, in Rockland County, because of the bad habits Rockland County had some years back, we are under the, not under the oversight, but we're under the monitoring of a control board because we have deficit bonds we've taken out and we're paying them back. So at the end of the day, and some people don't want to hear this, but it's a reality, and I'm a former Civic Association president. I understand this power. It's a strong power if it's used properly. At the end of the day, it is up to the voter. The voter is the one who ultimately controls government, whether it be village, town, or county, and of course, or state, of course, and federal. We have a lot of the elections coming up this year, but I'm talking locally right now. because that really is my true focus. So again, people get frustrated with that because they don't seem that they can actually win their races. But let me explain something to you. You can, and I can tell you it's frustrating for me as someone who's very focused on local issues to see the turnouts in local elections. Typically, you'll see this November, you'll see a turnout of probably about 2/3 of the registered voters, which is nothing to write home about because that's typical in a national election. In local elections, you tend to see about 1/3 of the local voters turn out for voting. That is really an embarrassment. It really is. And if you just think the Legal Women Voters makes this, Linda Byrne, Legal Women Voters, makes this point that every naturalization ceremony, when you look at that number, that 33% number, 35% number, you start thinking about how many people actually elect your representation. It's actually about 18% of the voters. So get out and vote. Have your neighbors vote. Form citizens groups, civic associations. We have Coupon here right now in Rockland County. They have chapters all over this great county. So that's one way of dealing with that. I had to write some notes today because it's been a bit difficult getting around. But second, I want to speak about something else that we're doing here to ensure the health of our community. And I want to preface this. This is a health commissioner's order that Dr. Rupert, our Commissioner of Health, issued today. This is similar to an order that's already in effect in Orange County. And in point of fact, this is something the state has been looking to do to ensure that these things are done right. Our local Department of Health has always had limitations put on them partially removed by the state. There were times where they were almost unilateral, but they do not have that ability now. They have not been allowing us to engage in protection of our most precious resource, and that's our children. There are concerns here. The concerns that we have heard from our health professionals, and again, this is a health order, not an executive order, either by me or by the governor. The concerns that are being raised is that children are carrying the virus, they're bringing it home, they're spreading it amongst themselves, largely asymptomatic on top of it all. And our county commissioner has taken to the exact face covering and social distancing requirements that have been in place by the governor's executive orders for over 6 months now, and fixed responsibility for compliance during school hours to the adults charged with these children's care. And that is truly what this is all about. And there's some details in a moment about that. We're going to be focusing on transportation, not so much the schools. The schools have their own rules and regulations in there, including making sure children get breaks from wearing a mask. That's not something that's going to be done 8 hours straight or anything along those lines. But that is really what it comes down to. We want to look and make sure that we can enforce the intent of the law that has been around for some time, and make sure we focus on the correct person. But I want to focus on some of the comments we got back on Facebook, that this does not mean children wear masks all day in school. That never meant that. Schools already have plans where they give the kids mask breaks, it allows them to social distance and take the mask off. This is not about, the other thing that's come up is there's some comments that came in that said there's a difference. We mirrored the exact language as I was told by a health department that was in the executive orders. Now we're hearing that potentially there may be a variance in one of the areas where the age of 2 or to kindergarten may be coming up. I heard this coming in already. I got some calls from the front desk. We will look into that, and if the language does not marry up to the existing language, we'll make an amendment to that. So I want to assure anybody who's in that area of concern, I have not had a chance to look into it. I just contacted my county attorney just before I got on the line with you. If there is a mistake there, we'll change it. It's as simple as that. So if you are confident that's what it is, we'll be able to confirm that and show it order, and we will get a change out, and we'll announce it the next time we get together, so we can see what's going. But again, I want to ensure that the primary focus of this is going to be on our bus transportation, which frankly we have gotten a lot of calls. I cannot begin to tell you how many people have called and shown and given us videos and pictures of children on buses without masks, and that is a problem, obviously. So we're responding to your complaints and your concerns. That's exactly what we're doing. But again, we'll make sure we get it right. We don't continue wrong things. So we'll look into that other issue that was brought up. As I said earlier, this is something that was done in other counties. Orange County has a very similar regulation. Their health department has one. And the order basically says that all educational institutions, child care programs, and school transportation companies are responsible to require and ensure that all children and students over the age of 2 cover their nose and their mouth with a face covering, presuming, of course, they're medically able to do so. You are allowed, and this does happen in schools, there are approved mask breaks that go on, obviously, where children can be socially distanced. We also have situations with children involved in physical activity where a mask is going to compromise their comfort at the very least, or maybe more. Nobody wants to see that. So those rules are in effect. And again, this is something that already exists. The executive order has already said that. It's been around at least 6 months or more now. But here's the question. Why did this happen? What was the issue? Why did, out of nowhere, do we see this need real or perceived in some people's minds, to put this order out? The health commissioner, Dr. Rupert, very smart person. She got us through the measles crisis last year. She looked at the executive orders and she said, you know something, there's only one problem. The executive order says you shall wear a face covering if you cannot maintain social distancing and you're medically able to do so. If you don't, according to the executive order, you can be cited. Now here's the problem. Picture a 7-year-old without a mask on or a face covering. What is going to be done? Do you think anybody's going to give a 7-year-old a ticket? Therein lies the problem. And the worst part about it, frankly, is that there are people who are in charge of those children during the day. We're parents who, my mine obviously, are grown quite a bit and they're gone, but we have grandchildren now in the family. The bottom line is that we entrust people to care for our kids properly, and that is a fair expectation. So, this health commissioner's order actually does, it takes the responsibility off the child, of course, properly, and places it on the caregiver, places it on the transportation department, places on the school district, whoever may be operating the buses. That is really the institutions that be held responsible. Each violation of the terms of this order constitutes a separate and distinct violation, subject to a civil penalty of $2,000 per violation per day. The staff from the Rockland Health Department Department of Health will be out enforcing this. They're from the Rockland Codes Initiative. They've been out doing many other things in protection of the health of this county. They'll respond to a timely manner to any complaints that we have, and in accordance with operating hours of the educational institutions, child care programs, and/or buses. Again, I want to emphasize, the initial primary focus here is, again, complaint-driven. It is primarily, we're looking at the school buses, the transportation of these children, who are really in close quarters at times, well beyond the 50% capacity limit that they're supposed to be engaged in, and not wear a mask. And you know something? I don't know what so difficult this is. When we first discussed this, when the commissioner came to me with this approach, to me it's a very simple thing. I'm a parent. I know what the rules are, and my child has to abide by those rules. And I've seen some of those comments in Facebook today also. Nobody's looking to be injurious to a child. Nobody's looking to make a child uncomfortable. It's what we're dealing with today. And again, as I said earlier, there's plenty of opportunity for kids to get those masks off at school and take a break. That's what's going on right now. But the bottom line is, right now, we have to look at the fact that you go to your school bus, have a mask, have a face covering. Okay, if the school bus door is open and the school bus driver sees you, he or she should say, you're not going to get in the bus until you have a mask. And ideally, they'd have additional masks over at the school on the bus. That would be a normal course of events. So that's what we're looking to do here right now. Again, this is being driven by the health department. This is a health commissioner's order. Getting backing track, I want to emphasize, we will look at that issue that has come up a couple of times, phone calls coming in here. We'll look at that, and if there's an error there, we will certainly correct it immediately. But for right now, I'm going to give you a phone number that you can call in case you see these violations. Our number is 845-238-1956, 845-238-1956. Now, this is Monday through Friday from 8 a.m. to 5 p.m. Or you can do email, which will be put up on the comment section when we're done here. But it's COVID Call Center at co.rockland.ny.us. That's exactly the reason why I'm going to put it on the comment section, because there's pointless trying to write all this stuff down sometimes. But one thing I do ask of you, I do ask that you give good information when you call. Try to get as specific as possible. Name of the bus, plate number if you can get it, or bus number if you can get it. The exact time. Where did the bus stop? Where did they go? What direction they're going? If you happen to see the bus pulling into a school, by all means tell us who the school is, because a number of these complaints will be acted upon as follow-up investigation. I got my man behind the curtain, John Lyon, my communications director, waving furiously at me. He's going to find out what's going on. John?
I just wanted to jump in here for a moment. You touched on it briefly. When we get complaints, the more specific you are, the better. So if we know that there's a bus dropping off at a certain place at 8:30 a.m. every day, we may not be able to respond right away in that moment, because these are staff from our Department of Health. There's a lot going on in our Department of Health right now. But it may be that the next day we are there at that time when the drop-off is taking place, so that we can witness these possible violations and proceed as necessary.
Exactly. And that's exactly right, why it's important, who, what, when, where. You want to know exactly what happened, take some notes, make a phone call, and get the specifics down pat. It makes it a little bit easier. And again, if you're concerned enough to make a complaint, we're concerned enough to make sure we follow up on your complaint and find out what's going on and address the issue. That's the important thing. I also want to take a moment to commend our health department. Our health department has gone through an unbelievable period of time now between the measles and now COVID. It's been nonstop here in Rockland County and other counties obviously also. But in Rockland was the one county in New York, in addition to Brooklyn, who had to deal with the measles epidemic. So it's been very difficult. And I want to also thank our law department, particularly our Deputy County Attorney, Bridget Botta, for her work on this. And again, what drives this is the health of our children, the health of our families. No more and no less. And again, we're building off existing emergency order. We'll make sure that it is aligned properly to your concerns I mentioned earlier. And I'm re-emphasizing that because that's what I want to make sure everybody is hearing that. Again, we have on now our staff from the county have partnered with our New York State personnel and are undertaking patrol and enforcement actions within the red and yellow cluster zones. We have 4 staff members who took part today. I believe we have 7 taking part, it was yesterday, 7 taking part today, and 13 or 14 will be taking part tomorrow. Now, most of you have read this. This is a task force, the cluster impact areas that the government has identified through looking at the incidence of COVID-19 infections. We have been cooperating with them. We have assigned personnel there. If you saw, there was an article in the paper, I think it was yesterday's LOHUD, where there was some threats about fining various governments, and they mentioned Orange and Rockland. I spoke to the governor by phone a couple of nights ago, okay, and he made it very clear. And his staff actually did a mea culpa. The Orange and Rockland comment was more a geographical comment. He was focused on 3 areas. He was focused on Ramapo, the town of Ramapo, the village of Spring Valley in Rockland, and he was focused on the village of Palm Tree in Orange County. So that was more precise. And if you look at the rest of the story, beyond the headline, you'll see that was all detailed, in the story that was written by the reporter for LOHUD. I want to specifically thank the personnel from here in Rockland County, because they're doing something very special one more time. They're rising to a challenge and working to protect the health of the citizens of our county. The Department of Health, Office of Fire Emergency Services, Consumer Protection Office have made staff available to have these, to help all these efforts. But it's frustrating when you hear that other areas in this county are not joining in. Specifically, and I'm going to correct this in one moment though, the town of Ramapo has not joined in with the task force. They have not supplied personnel which had been asked for. The village of Spring Valley had not supplied personnel that had been asked for to be part of this task force to start addressing the illegalities going on that are putting our health at risk, and that has been very frustrating. The governor announced yesterday that he is going to withhold funds from municipalities and institutions that do not take part in the enforcements. I did speak to the governor personally the other night. I certainly expect to see staff from the town of Ramapo and the village of Spring Valley to be part of this now. But in fact, we can update you today. I want to acknowledge the village of Spring Valley and Mayor Simon. The village has now formally committed to sending up 3 police officers and 2 additional staff members to the state task force. We actually have the email here somewhere. It's in there somewhere. There it is. There it is. Yep, got the email here. So they have formally committed to this. And I want to thank the mayor, and I want to thank the good folks in Spring Valley, because again, these are the areas that have been most affected. The areas within 2 zip codes in Spring Valley, 10977 and 10952 in Muncie. So they've done that. But you know something? There's been a lot of conversation about how we're handling this, and most people have been positive. But you know, there's a way to do things. There's a way to properly affect change. We started off where we had obstacles in our way. Now, having conversations with the parties involved and trying to get them on board is key to leadership. That's how you get things done. It's very simple to, you know, yell and scream and make noise. And some of the keyboard warriors I see on Facebook now of late have been getting very good at that. They keep yelling about things and talk about you should do this, why don't you do that? Because I mentioned in the outset of this program, there are prescribed responsibilities for each town, each village, each county that can and cannot be done. And I would just simply submit that this administration has been very aggressive in areas of enforcement. You recall about our illegal housing task force and what was done after that. We brought in millions of dollars in fines. We provided clean housing for so many people who were being abused by landlords, or slumlords actually. We took the bull by the horns and we found unique legal ways to get the thing done. And that's really what's key. But at the end of the day, you know, the same people who say people should all play by the same rules. Well, it works both ways. This government plays by the rules also. So we will do whatever we can, and we will work together with the governor's orders to ensure compliance and restrictions, and we will try to bring this pandemic to a halt locally. You know, again, the executive order 202.68, which was issued by the governor on October 6th, said we could not enforce his orders. That was just a reality until that executive order was issued. According to the limitations set by the New York State Public Health Law, the Commissioner of Health is limited to enforcement of requirements of the New York State Public Health Law, of New York State and local sanitary codes. The governor's executive orders were neither. So again, even with the governor's executive order saying you should do this, they were not authorized by another section of law. This is extremely confusing. I'm not going to go too deep into it because it probably put you to sleep at this point. But these are the laws we're dealing with, and we have a very competent and able law department to help guide us through this. Because if we do it wrong and we send the wrong person out to try to take enforcement action, for example, a number of things can happen. Number one, that person, that civilian, could get hurt. Number one, that civilian is not trained as a law enforcement officer, for example. Number two, if you go and under the color of authority try to do something and it goes wrong, there's an argument, there's a fight, there's a back and forth, what happens? I got news for you, we're all on the hook. Because when government doesn't get sued, we get sued because we pay the bill. So there's a right way of doing things and a wrong way of doing things. And I would put this administration's efforts over the past 7 years on being aggressive, putting safety first and health first, up against anybody. So if there was opportunities for us to do something, clearly we'd be doing it. And today is a perfect example because of the recent executive order that freed up that section of law that would not allow us to take the step that we've been taking. So, you know, to be clear, we're still limited right now locally. We for commissioner's orders like the one issued today, we must consult with the New York State Department of Health before we can even send them out. Now, this is spelled out in the governor's executive order number 20219, which is dated April 19th. Now, again, I mentioned earlier about the governor having the ability to, you know, to do certain things under executive law, chapter 24. Now, the bottom line is that normally I was able to offer up emergency orders. I did that I think once or twice, once during a snowstorm. In March 18, 2020, the governor took away that power for all county executives and also the mayors. We are limited to what we can do, but we will always try to find ways to support the mission of every Rockland resident. We will be aggressive, as I said, but we will also be legal. And again, we do this. We agree when people say follow the rules, they want people to follow the rules. Well, we do the same thing. As recently as October 12th, just a few days ago, Governor Cuomo was in a conference call with reporters. He reasserted that only the state could set restrictions to control the coronavirus spread, not New York City Mayor Bill de Blasio and not county leaders. The mayor is, I quote this, the mayor has no legal authority to impose restrictions or reduce restrictions. No county executive has legal authority, but they can propose, any mayor can propose, suggest, but they're all proposals and suggestions. They're not orders. And I just, to set the record clear and straight, we've done that here in Rockland County. This administration issued an executive order a while back for, guess what, for anti-hoarding. Remember that toilet paper you couldn't get? We were ahead of the curve. Here in Rockland, we went to establish an order that we would have addressed that immediately early on to lessen the discomfort, a fair way of putting it, I guess, for all of you. And that order was suspended by the state. We also had shopping protocols laid out. A lot of the shopping protocols that eventually were adopted, where stores had to make sure that people walked in the same direction. Stores had to make sure when so many people came in at one time, they had to abide by a reasonable amount of people inside at one time. Sound familiar? That started from this office and this administration. Another thing that if we had, and nobody will know the answer to this question, what if this was done earlier? Maybe a few people, less people would have got infected. Maybe a few people, less people might have died. We don't know. But we did put that forth. It was denied. You also remember back in April 4th, we suggested a containment area. First time this virus visited Rockland County, we wanted to control it, much like it's being done right now under the governor's order. So, I mean, that was something we put forward, and guess what? That was not even allowed to happen either. So at the end of the day, we ended up, we did all these things and to try to get this to happen. And again, we have to be legal. We have good ideas here. We will move them forward. I'm heartened by some of the work that's being done now. I'm starting to see this come together a bit, seeing the state and the governor's people working more hand in glove with local municipalities on a regular basis, which that can only be a good thing. Working together, we can get a lot done. The other thing I wanted to bring up also is we are now down to literal final day, final hours. October 15th is the last day to complete the U.S. Census. What's at stake here is $675 billion in annual federal funding, and it's one of the reasons why the census is so important. The federal dollars go directly towards programs like residents depend on, like health insurance, infrastructure, schools, and nutrition support. Monies we aren't counted, monies go elsewhere. So if we don't get our share, somebody else gets that money. And we've heard before, New York State gets underfunded when they look at the taxes they send to the federal government and given with value we get back here, a lot like the MTA apparently. But according to the 2019 census population estimates, there are 107,002 housing units in Rockland County. And with the current self-reporting response rate, which show at just under 71%, there are over 31,000 housing units that we estimate had not been counted. That, using an estimate of $2,500 per household, that's $311 million annually lost to Rockland communities. So again, we're pleading with you. If you have not been counted, you can go online at my2020census.gov, my2020census.gov, or by calling 844-330-2020. Please do that. Be counted. It's important to our families. It's important to our community. It's important to our county. Do we have anything else, John?
The one thing I do want to mention here is the specific language that's included in the governor's latest order that sort of changed things and our ability to enforce things. And that is Executive Order 202.68, and I'll put this in the comment section as well. Quote, any local government official, the executive order now allows any local government official to assess a civil penalty for violations of executive orders pertaining to maintaining social distance and wearing of face coverings. Previous to this order, all of us here in county government were essentially powerless to enforce the governor's orders. Right. That is what recently changed.
Yeah, and if you look at the orders, the way they're written, if you look at them, like I mentioned earlier, I'm not going to go through it again, but there was a correlation legally between an executive order and public health, one of the statutes in the public health statutes. And there was not a nexus. There was no connection between the two. And without that connection, the enforcement couldn't happen. And again, there's a right way and there's a wrong way. There's following the rules, following the law, and not. And the stake we have here as the stewards of taxpayer money is to make sure when we do things, we make it with the best faith effort, that we don't do things that end up coming back and creating liability issues. You've heard the nightmares of litigation where multi-millions of dollars are awarded to somebody. We don't want to have that here. We have enough troubles. We don't need any more aggravation. So again, I have always been aggressive. You all know that. I put all of you first and do whatever we can do to get the right thing done for you and your families. I am not going to do things that are risky. If somebody wants to get on Facebook and make a lot of noise, blah, blah,